a centennial story from the Portland Clinic. On the eve of retiring from his 40-year medical practice, Dr. Jeffrey Cleven will tell you he knew back when he was in grade school that he'd be a doctor.
Started with a couple of TV programs that I was watching at the time about doctors.
3 stars will shine tonight.
Two top-rated network medical dramas in the 1960s not only caught Jeff's attention, they sent him on his career path.
So I kept thinking about it and kept working towards it and knew I had to have good grades and I had to work hard, and I did. And so I eventually made it. But it all started, I think, just with that, with watching TV shows about doctors.
With the trend moving away from solo private practices and Dr. Cleven's desire to work with a group of physicians, he established his primary care practice at the Portland Clinic. He says it was the right move.
We had a good group right from the very beginning, from administration right down to the medical assistants and physicians that I worked with. So I liked it. I liked it here.
And Dr. Cleven was liked by his patients, many of whom have been with him from the very start of his practice. Along the way, Dr. Cleven was named one of Portland's top physicians, and for 23 years also served as his clinic's medical director, a key player in building the Portland Clinic for the future.
It's good to see you.
Did you bring Norman with you?
Joyce Coates knows Dr. Cleven well, now as his patient and formerly as his employee. She was Dr. Cleven's first medical assistant, the staff person who answered his phone, booked his patients, took their blood pressure, and gathered their lab tests.
All he had to do was go see the patient, then tell me what he wanted, and he left.
I had nothing to do.
Laughter aside, Joyce says she helped her boss in one important respect.
He knew patient care, but he didn't know clinic care. So we worked together on that, right?
That's right. That's how you train me, right? Yeah. So everything I do wrong is your fault.
I know.
As to the biggest changes in healthcare over his 4 decades, Dr. Cleven points first to the computer.
Has been a huge change. It has created a lot of work that we didn't used to do. Some of it's good and some of it is not. So I think a lot of doctors now are spending an incredible amount of time satisfying the computer, and it's taken away a little bit from our patient interaction.
Another major change, the shift to preventative medicine, as patients receive more comprehensive insurance coverage.
And that's made it a lot easier to try to see them when they're not sick and talk to them about things they need to pay attention to it. Diet, exercise, weight, those kinds of things, which I've spent a lot of time emphasizing through the years.
That's where the computer helps, Dr. Cleven says, with on-time reminders for exams, tests, and vaccinations. For Dr. Cleven, retirement will mean more time for family and travel, more time with his grandson, Aiden. What he'll miss and enjoyed the most about being a doctor, his interaction with patients. But was his medical career anything like those of Richard Kildare and Ben Casey, the TV doctors he watched as a kid? Pretty much, says Dr. Cleven. But since he strived to avoid major surprises with his patients, his successful medical practice has been as enjoyable, if not as exciting, as those on television.
My life, there's a lot of excitement, but there's a lot of things that are just common everyday things that I do, and that's different than what I saw, but I still have enjoyed it.
After all, Dr. Cleven points out, he had more important reasons for choosing medicine.
I think it's that you have to know that you're going into something as a career, that you are going into something for the right reasons, and if you understand that, I think you'll do well and you'll be successful and you'll feel good about what you've done. I think it needs to be for the basic reasons of wanting to do some good with patients.